Welcome to the FYE Talks podcast for our episode, COVID-19, What Are Students Thinking?
Hello, everyone, and welcome back to another episode of FYE Talks. I'm your host, Trinity Bradley, and today with me I have Whitney Taylor and Martha Gluding, and today we are going to be discussing the COVID-19 and also some student questions and concerns. So, would you all like to introduce yourself and tell us about what you do at the school and what your job title is? So, whoever wants to start.
Go ahead, Martha.
My name is Martha Gluding, and I'm the director of the Associate Degree Nursing Program here at the college.
I'm Whitney Taylor. I am the Human Resources Director and the newly appointed Healthy at Work Officer.
What is the Healthy at Work? If they don't know.
So Healthy at Work Officer was one of the 14 items that the governor mandated all employers to have in place when they reopen. So the Healthy at Work Officer's job is to be to make sure that we're in compliant, to keep up with all the changes that happen, but also to be a person that someone can come and talk to if they see something that they think like we can do better in regards to COVID-19.
Okay, so I guess the first question would be, how would you explain the coronavirus to someone if they had absolutely no clue what it was?
I would say, on simple terms, that the coronavirus reminds me of like the flu. It's that contagious, I think. The thing with the coronavirus is that we have no vaccine against that. So it's a brand new virus. No one has any immunity to it, except for the people who've had it. And I think the other thing, I say it's similar to the flu in the fact that it's contagious, but the scary thing about the coronavirus is because it is new, we don't know exactly what it's going to do to an individual. It may be that you are asymptomatic with it, or it may be on the other extreme, you could die from it, or you could spend weeks to months in a hospital trying to recuperate from that. We also don't know what the long-term benefits of that virus are, which is again different from the flu. The flu's been around for a long time. We know how to treat patients with the flu, and we can sort of predict how they're going to react to that flu. So the coronavirus, I would say, is similar to the flu in the fact that it's transmitted very easily from one person to the next. The scary thing is it's a brand new virus, and we don't know a lot about it.
Yeah. So with the coronavirus being a big topic and, students are worried about their own safety, do you think this would seriously impact the students' morale, being that, maybe they're doing online and they've never done online before, or just them trying to transition into college but having no clue? Do you think it would impact?
I think any transition that the student makes to online when they weren't planning on that is going to affect the student. It's difficult to go from a totally face-to-face environment to an online environment unless the student is prepared to do that. And if they come in, I've had students who advise that want nothing but online classes. I've had other students who didn't. So I think it's just going to be educating the student, making sure that the student knows their resources are out there, and that we're here to help them to be successful in that switch.
So, do you feel that ECTC is well supplied, organized, and prepared for when the students return?
Yes, I believe that we are. I guess it was 2 weeks ago now. The last week in July, we had the health department here, and we did a walkthrough with them. And part of that walkthrough was for them to think of things that maybe we hadn't thought of. And it was a really good outcome. There was just very minimal things that we kind of tweaked along the way. One of the things that we are doing is limiting the number of folks in a classroom. And we use two different measures for that. We use the 6 feet apart rule, and we also use what we call a capacity rule. So the governor has said that we cannot have more than 50% capacity. So if you go by fire marshal rules, most people get 20 square feet. Well, with 50%, they would get 40 square feet. So we can take that rule and the 6 feet apart and then determine our class sizes and how many students we can have in a class. So we have done it to all of our classrooms that are meeting face-to-face, and we have done other things. We're not going to be able to use water fountains, but we do have the water filling stations. We are allowed to have vending because vending is an item that is prepackaged, and we do have hand sanitizer everywhere, and places for students to sit, but you're not going to be able to like sit in a group anymore. If you walk around, you'll see that most tables have one chair, if we do have a table. So we've done a lot of planning, and I feel like we are really prepared. We have been doing a lot of training with our faculty and staff as well. And I think it's just one of those things. We're not going to know until we kind of get into it. What things need to be tweaked and everything. But I think continuing to communicate with students, encouraging students to look at their schedule, because those have changed. We have allowed more classes to go virtual or do a hybrid. So I think if you're a student, that the first thing you need to do is look at your schedule, because there's been some changes to that, and they should be pretty much finalized by now. So look at your schedule, figure out if you're on site. Some of you might not be on site this semester.
Yeah, one of my next questions was, what steps have been taken to notify students that their classes have been switched to online?
Right. So Emmy Loving has been doing the Facebook Live videos. There was a message that went out to all students from our Dean of Students, with also a video on how to check your schedule. And faculty that have switched have been contacting students as well. And Martha, you can speak some of that as well.
Nursing has notified their students as to how their classes are going to be switched and what we're going to be doing. Yeah, I think one of the harder things, Whitney, when we all come back together is going to be keeping those students 6 feet apart. Because, we've even thought about when you dismiss classes or you send classes on break to the bathroom, you're going to have to keep those students 6 feet apart. And that's going to be hard for the students to do, too.
Yeah.
It's just a total change, because we were also used, like the lift lounge, we were all used to just coming in here hanging out, but we can't really do that no more.
Yeah.
And I know nursing, those classes are so much like a family, because you all spend so much time together, that I fear that you're just going to go up and start talking to each other, and
It's gonna be
breaking the
hard.
6 feet rule.
Yeah.
So what has your department done, Ms. Gluding, to prepare for the first day of school?
Well, the faculty's been working all summer, we've had several meetings over the summer. They've created their calendars, they've contacted students. We've come up with nursing policies that are going to be different due to COVID. We're trying to contact students with things that's been added to their dress code, such as face shields and masks, because students will be having to wear that to clinical every day that they're in clinical. And it's mainly just, and talking to Whitney a lot, trying to follow the ECTC guidelines, as well as talking to the clinical facilities to know exactly what's going to be required of that student to allow them back into the clinical facility.
So what if a student shows up on the first day of school not knowing their class has been switched? Where would they go?
I believe FYE is actually going to have stations set around, so that if you can't find your class or something's going on, they'll be right there in the buildings to help. They can contact student affairs. They can call the instructor directly and just let them know, hey, I misread this, I'm on site. I'm going to go to a computer lab. We have some computer labs available in ATB, and log in and get started. Unless the class is asynchronous, then they would with an asynchronous online class, you do it at your own pace, sort of. There's deadlines attached to those, where the synchronous you would meet at a particular time. So there will be lots of people on site the first week to kind of help manage that, because we do anticipate some of that.
So you said the FYE, so we are actually setting up the tables for WOW Week, which is the 17th and the 18th. And that'll just be questions that if the students want to walk up and ask us questions, we can help. Because I might be at the table, I don't know, just depends. But if you have any questions, talking to the students, if you have any questions, you can just come up to the table and ask us, or you can walk into any of the departments on the first floor of RPC, and they'll take you where you need to go and help.
Yeah, and even our maintenance and custodial staff, they're here to help too. They'll help you guide in the right direction. They've done that every year, and that's kind of part of their goals as facilities operations, to interact with students and help them.
So my next question, and I came up with this question just out of curiosity. So how do you see the flu season further complicating campus life, such as classes and services?
I think when students get the flu, they're going to think they got coronavirus because no matter what you come up with now, I mean, if you have a little bit of diarrhea, people are scared to death they've got the coronavirus.
Yes.
And so I see that, yeah, they're gonna get that and think they got corona and everything's gonna.
Yeah, because, I'm not a physician. I can't diagnose you. And the symptoms have changed. CDC just updated their guidelines this week as far as what to do if you've been exposed. So that information is constantly changing. So, as a Healthy at Work officer, I have to kind of filter through if a student calls and says they're sick, we want you to stay home. And we hopefully have prepared our faculty where they can work with that student. Because the rule is currently, if you have symptoms of COVID or you test positive for COVID, you quarantine for 10 days, and then you cannot have a fever for 24 hours without any kind of fever-reducing medication, which has changed from the 72 hours and 14 days. But if you're exposed to someone, then it's a 14-day quarantine. So you might be exposed, but not have symptoms, and they recommend you quarantine for 14 days. Again, those guidelines constantly change, and how does that play into campus life and class, and if you need to miss a class. And so that's why we did shift a lot of things online, because a lot of folks are asymptomatic and they don't have symptoms, and they're able to continue to telework or do virtual learning. So that's the way that we can accommodate something like that. But, honestly, it's going to be case by case.
Yeah. So you all kind of look at it as it's the student's responsibility to, take initiative and be like, I'm sick, I need to stay home, like, I need to
Yes.
email my professor.
Yes.
Instead of being like, oh, well, I feel a little bit bad, I'll be fine.
Yeah. And
If you think that
yeah.
you're sick, just
Yes,
Stay
if
home.
you're sick, stay home and monitor your symptoms. A lot of times it could be seasonal. Allergies are a symptom of COVID. So if you know that you have seasonal allergies, then more than likely that's probably what it is. But if you're not sure, you can't distinguish, then we always recommend seeking help from a provider.
So if a student does test positive for the coronavirus, do they have to report to somebody at the campus, or they just...
If they test positive and they have a face-to-face class, then they would need to report to that face-to-face instructor, and then from there we'll go through that process and they'll contact me. But if they're virtual, they don't necessarily need to report unless they aren't able to attend class because they're ill. It's just going to depend. They would handle that any other way that they would handle if they were sick and they couldn't attend class, or maybe complete an assignment, or there's something with testing. But that's,
Yeah, I know that
to that,
with
Martha.
the nursing department, because we are in the hospital taking care of patients, we're going to require that every student who tests positive has to notify the nursing department immediately of that positive check. And the healthcare provider's recommendations is what they need to do.
Yeah.
So
I do recommend that everybody get their flu shot. That's going to be so important this flu season, to get that flu vaccine. Yeah.
I get mine every year because I don't want it. I don't want the flu. It's not fun. So, Ms. Gluding, using your best medical judgment or knowledge, what do you think the number of coronavirus cases will do in the fall?
I'm afraid they're going to increase unless we get that vaccine. That may help, and I don't know when that's going to come out. But, and I'm no Dr. Fauci, but,
Yeah.
but I would say that they're going to increase. I say that because I think more people are going to be congregating together. Even as schools open, for the children and for the adults that are coming back, I just am afraid, and people are going to get more lax on their mask and hand hygiene. And if they do those things, I think it's going to increase.
So I know I saw something this is another curiosity. So I saw something where Bashir said that you should cancel face-to-face until September 28th and do online. So is the college going to be doing that, or is it still like the face-to-face as of right now is still going?
So that was a recommendation that he put out yesterday for the K through 12.
Okay.
But he did address in that press conference that that would not impact colleges.
Okay.
That we actually report to the Council for Post-Secondary Education, which goes through his office, and we're continuing to be allowed to start back on the 17th and follow our plan that we've submitted to them.
Okay, so the next part that we're going to talk about is student questions and concerns. So
Okay.
I posted on the KCTCS student feed, and I was like, hey, I'm doing a podcast. If you have any questions, I'll have these people with me. So some of the questions, they're kind of all which different way, but I just listed them. So the first one was, what are the odds of all classes eventually being online due to COVID?
I would say it's kind of great. It could happen. I mean, if people are not responsible and, go to work, go home, go to the grocery if you need to, but, continue to social distance, then cases are going to rise and the governor could potentially mandate that we shut down again. So, I mean, that is a possibility. I would not rule it out.
Just make sure you wear your mask right and wash your hands, please.
That's right.
Please wash your hands.
Yes.
So,
washing hands, yeah.
Another big topic that was on the app that I saw, and it was a huge debate, and I didn't even know what to comment, so I just put it in here.
Okay.
So a student asked, what if they have a disability, such as being asthmatic, really bad, but they're still being required to wear a face mask?
Okay, so if you feel like you need an accommodation to a mask, then you want to reach out to Teresa Brown. She is our accessibilities coordinator for students. So our role is to keep everyone safe and healthy. And so we are not going to allow you in a classroom without a mask on. So if you need an accommodation, you have a choice. You can wear a face shield that she can issue you, or you can do online course instruction for this semester. But our goal is to have everyone in the classroom either covered with a face mask or a face shield. And face masks are preferable, but we can accommodate with the face shield. We do have permission to do that. But and again, that is just something that you would work with her to get that accommodation.
So another question was, what if they get back into the classroom and there's an outbreak of a few people? What will the school plan to do? How will this be handled again?
So let's say a student calls and they tested positive and they call me Tuesday and it was a Monday class. So again, let's go back to that face mask wearing. So we have 6 feet apart in the classroom and we're wearing our mask. So by health department standards, you will probably be considered a low risk, the student. What we will do is we will do communication. We have a communication plan for each different scenario, and we might even have communication to the public as well. And then if there's a positive case in the classroom, we have to close that classroom for 24 hours before we allow our maintenance in to clean. And then we will clean that, and then the class should be able to resume after the 24 hours has been met and we have cleaned and disinfected. So it could be up to 48 hours before they're back in the classroom. It just depends unless we shift that class. And then those students would just need to monitor symptoms. But close contact means that you are less than 6 feet apart for more than 10 minutes, and typically you're not wearing a mask. So we are trying to prevent close contact. That's kind of our goal.
So the next one is, should all classes be online, even though some people do not have access to internet or do not know how to use a laptop or have basic technology skills? That was another one.
Well, I can answer that from some of the technical programs. All classes cannot be totally online. I mean, you've got those hands-on labs that have to be held, and it's real hard to switch those. So I don't think totally online is the answer to every class. Yes, decrease student traffic on campus as much as you can, but some of those classes are going to have to be.
So what can they do if they don't have a laptop or stuff like that? Where can they go?
So there is an FAQ on our Healthy at ECTC website, and there is a question just specific to that is fully answered. And I don't want to misspeak, but there will be some areas on site that they can come in the computer lab. We do ask that you bring your own earphones and headsets that you can purchase with financial aid funds if you have those available in the bookstore. And then we do have places again that we've marked off over the summer and last spring where you can come and use our Wi-Fi if you need Wi-Fi. And in our Hardin County community, they have listed several places. I know Freeman Lake is one of them off the top of my head that you can also access free Wi-Fi if you need it, if you have the device. Last year we did allow students to check out laptops. I'm not sure if we're doing that this semester. I'd have to check with Student Affairs, but we do have that as a question on our FAQ on that website they can check out.
So if a student would need a laptop, should they try to contact Student Affairs or just?
Yes,
Okay.
yes.
So another one is, what if you get COVID during the semester and you fall behind while you're on SAP? Will you still get reprimanded for falling below the SAP?
Falling below the what, Tiffany?
The SAP.
Oh,
That's where you have to make a certain grade and percentage of your class or your financial aid, like.
So I think that's going to be handled like it would be handled for any other illness, and we would follow that code of conduct and those procedures for that appeal process. Again, I'm not an expert on SAP. That's more of a Michael Barlow question, but I would assume they would use those same guidelines.
So if you have a question about your SAP and you get sick, just contact the financial aid office.
definitely, because financial aid that's also something that changes a lot. It's hard to keep up with that. So I'll always refer students to financial aid. It's a financial question.
So how are we supposed to go to our program's orientation? I know every program's different, but it kind of depends.
Well, I know nursing we found a large room on campus, so we're going to bring the students back. We won't have the entire program here the way we've always done in the past, but we're able to have a class in a large room for a shorter period of time.
I know that the freshman orientation, we are no longer doing like the in-person in the auditorium. We're just going to do like a drive-through. And we're going to set up, because I made the folders up, and we're just going to hand them a bag and be like, if you have questions, just call.
Yeah, and a lot will be virtual. I mean, that's kind of, I would like to think that people have kind of been prepared for that for the last 6 months or so. You know, that this not going to really be a big change or adjustment for a lot of us because a lot of things are going to be virtual.
The next question is, will tuition costs be reduced since students aren't experiencing what we've paid in full for, such as being placed online versus face-to-face instruction? That's a big one.
Yeah. No.
No.
Because I remember they brought up something, it was like, if you were originally scheduled for an online, you didn't have to pay the online fee, but if they switched you from face-to-face to online, you didn't have to pay the fee. So they were wondering if it's like, the ones that were already online, are they going to have to pay the fee as well? But the other ones don't have to.
I don't know.
I don't know about that either.
No, either. I can't answer that one. I'm sorry.
I feel like that would be a business office.
Yeah, you have to cut that question out. I don't know.
Business office question.
Yeah.
So the next one is, there's been rumors that students will be expected to clean and sanitize classroom, labs, and other areas. And students have expressed frustration that they will lose class time that they pay for just to take on a task some feel that it is not their responsibility. So what are your thoughts on this?
So we have a facilities team, but they cannot clean after every class. We clean twice a day during the day and then once in the evening, which is more than the recommended by CDC guidelines. So we will have cleaning equipment in every lecture room, and the faculty members will clean at the beginning of the class, and they do have the option to ask the students to help clean. And you know, if you're worried about your safety, you might not have any problem wiping down a desk. I mean, I don't think you're going to lose less than a minute of time in a classroom, but these are unprecedented times, and we all have to be flexible, and we all have to give grace to everyone. But you're not going to be reprimanded if you don't want to wipe your desk down. But we are going to ask that in lectures. Now, in labs, are a little different because that's going to be part of your lab instructions. So you're going to have to clean your tools and equipment and wear your gloves. And that's going to be part of that instruction. So, if you go out and work in manufacturing tomorrow, they probably have cleaning protocol that you're going to have to follow. So, even our own employees, we kind of have that Planet Fitness mentality. If you use the copier, you wipe the copier down when you're done. So, I understand that you're paying for something, but these are unprecedented times, and again, we're trying to keep everybody safe and healthy so that you can continue to have that face-to-face instruction that a lot of people want. I mean, we're trying to accommodate that, but we still have to be safe. And
Yeah.
I mean, I'm just going to go back to just being safe and, being good citizens and trying to take care of everyone.
So what are you doing with what is the nursing program doing with their skills labs with safety?
Those students they will have an appointment to come in and practice in those labs. Any student in the lab will wash their hands immediately when they come in. They will sign in, they will put on gloves. They will wear a face mask and shield. And we've got them designated 6 feet distances where they'll be around the beds for patients. They will be monitoring each other. You will be spotting each other so that if I see you touch your face or touch your mask and you contaminate your hands, then you're going to have to clean those again. And then anything like that's going to be reused, like if a student has to practice putting on an isolation gown, then that gown will be sprayed with disinfectant before the next student uses that. And then the lab and specialist will be cleaning equipment and tables during the day as well. And most everything, I know students may have had an issue with cleaning, but most everything I have read and heard is that the majority of students are going to want to do a quick wipe of that desk or whatever before they sit down because they don't want to trust the person before them that they clean that properly. So especially with nursing students, I don't think it's going to be an issue.
Yeah.
And if I were a student, I'd want to clean it real quick.
I carry a can of Lysol with me because I work in a nursing home. So every time I leave work, I will take my shoes off and have a special bin that I put them in. And then I spray my scrubs off with Lysol and go home.
Yeah.
Because I was like, I don't want to bring none of that home. So you will always catch me with a can of disinfectant. So is there anything else you think you all should address for the students concerning COVID?
I know it's going to be different, and I know we're going to have to be real tolerant with each other, and it's going to be a learn as you go type thing, and we're all going to have to be patient.
Yes.
Just be patient.
I agree.
Okay, this is kind of like a question I was thinking. So if you see a student without a mask on, what are you going to do? You're going to can't really send them to detention or anything?
So we have plans in place. If someone comes in the classroom without a mask on, we have locations where the faculty member can go get a mask for that student. My experience has all been positive. This summer I've seen folks in the hallway without a mask, and I just say, hey, you might have missed our signs on the door. But we do require a mask, and it is also a government mandate right now in the state of Kentucky that everyone needs to be masking. So come with me, I'll get you a mask, and then let me know where you need to go. And I have not had anyone be rude or disrespectful to me. And, people are compliant, or they'll pull their mask out of their back pocket and they'll put it on. So, nobody likes confrontation.
Yeah.
But I don't consider that confrontation. I consider that me doing my part to keep my employees safe and the students safe. So.
I feel like it's also kind of, since, it's a community college, we all think of each other as a community and we're like, hey, we need to follow this so we keep each other safe.
Right.
Because, if they're like, hey, if we follow these rules, we'll actually get to come back to class instead of doing online. But I think, so you all don't have anything else? Is that
I
all?
don't have anything else. I don't.
Yeah, not that I can think of.
Well, I thank you all for coming on the podcast today, and we will see you all next episode.